Hi everyone, my name is Ali Raza. I'm the founder and CEO of Max Dental Marketing. Today we're going to be touching upon a subject that will enable you as a dental practice to beat and compete with large dental practices who have a large marketing budget. Every dental practice owner first needs to understand what the dental marketing ecosystem looks like. The challenge is that you as a dental practice are competing against a well-funded set of dental practices. If you are marketing in a metropolitan or a big city, chances are you are up against dental practices that have a lot of money. So the goal is to leverage your unique strengths to attract patients without matching the marketing budgets of the big players. In order to beat the big players, you want to understand that there are 4 levels of potential patients. First phase is unaware. These are the patients who do not realize that they need any dental care. People who are in their young 30s, in their young 20s, and they're eating well, they're drinking, they're enjoying, and they are not aware about the possible dental problems that they will face when they age. The second phase is the research phase, and these are patients who begin to search for information about potential dental issues. For example, common dental issues when we turn 40s, or any other common misconception or any other common disease or common dental issue that a person might face when they turn 40. The third phase is the practice selection phase, and these are the patients who are searching for specific services or practices. So, for example, if somebody has a cavity and they are searching treatment for cavities, dentist near me, or any other keyword that shows that this patient is ready to make a selection. The fourth phase is choosing the practice when patients are making their final choice. The problem is that only 3% of potential patients are actively looking for dental services at any given time. And 97% of the patients, 97% of the potential patients are in the research phases, which means that they need help understanding their dental needs. And the advertising focus of most of the dental practices is they are targeting on keywords. They are targeting on patients who are in the practice selection phase. When all of the dental practices are focused on the practice selection phase and they are choosing the keywords like dentist near me, orthodontics near me, root canal services near me, or any other services, when most of the dental practices are focused on this type of keywords, the cost starts rising. This is the exact dilemma that's happening with a lot of dental practice owners out there. They are spending aggressive amounts of money on keywords that are in the practice selection phase. The solution is to target patients in the research phase to allow you to reach more potential customers at a far lower cost. So the strategy that we recommend is to create free content that helps patients understand their dental problems and the potential solutions. You want to give immense value to your potential patient first so that the trust is really high. When the trust is high and the patient is ready for a procedure, you will be their first choice. Create a bucket of problems. Identify patient needs and problems and then create buckets. I'll give you an example of a bucket. Common dental issues after you turn 50. What are the common dental issues? Tooth decay, dry mouth, need a denture, or any other problem. This will work as a repository of videos that you can then push on social media, on YouTube, your landing pages, and you can even create ads from this. You can interview experts, you can call in dental hygienists, you can call in orthodontics. You yourself are an expert to create these videos. There are so many ideas that you can see in one of the prior video that we went ahead and published that will enable you to generate video ideas for your YouTube channel. Once you have these videos for every single problem bucket, what you can do is you can create a dedicated landing page for each problem bucket. And once you have a landing page and a video, you can start running these as ads so that whenever people are searching for a potential problem and that solution, this landing page and this ad that you just created for your bucket will be right in front of the audience. One good way to make sure that you are following up on patients who are searching for your dental practice is to use Pixel technology. And what is Pixel? Pixel tracking is you have a small piece of code on your landing page and any other assets that you have in your online marketing. And whenever somebody visits your website or your social media page or your YouTube channel or any other social platform that you own for your dental practice, the system or any other ad network will start showing ads of your dental practice to that user wherever he or she is browsing the internet. Follow up, follow up, follow up. Literally, follow up is the one thing that will set you apart from the rest of the competition. Why? Because when leads start coming in, the one problem that pops up is that leads start falling through the cracks. And when you have a team that is in place and committed to make sure that they are fully focused on following up every single lead that's coming into the system, this will not only help you make more money, it'll help you increase the patient intake and increase your revenue numbers. The practice is to make sure that you are continuously following up with them using these three mediums: call, text, and email. Technical tip: use custom audiences. Try to target audiences who have at least consumed 25% of your video content. Attention spans of people are really low and it's going down. So chances are, if somebody has consumed at least 25 to 30% of your video content, start retargeting them. When you retarget them, your ad will start appearing in front of that person and they will be more likely to engage with your dental practice. Optimizing call times is something that is not being practiced by a lot of dental practices. And if you adopt this methodology, you will start seeing that more patients will start setting up appointments with your dental practice. There are golden hours, and these golden hours are times during which patients are more available and they're more able to take and attend your phone calls. And this is between 5 p.m. and 9 p.m. during weekdays and weekends. Why? Because when people are in their offices, when people are going to the office, dropping off their kids, picking up their kids, they are not available to take the calls. So having a team in place that is able to call your patients or the leads that are coming in after office hours will ensure that you're getting more leads into your system as a confirmed appointment. If the big players are spending a large amount of money on online platforms, what you can do is you can start focusing on a offline strategy as well as an online strategy. How? Start identifying local businesses that can refer patients to your dental practice. Something like gyms, health clinics, schools, colleges, sports facilities, any other community events that are taking place in your local area. When you go into these events, chances are you will start promoting and connecting with parents, students, teachers, and a lot of the public that can be your potential patients. That's it. If you like this video, hit like, subscribe, stay tuned for more information that'll help you take your dental practice to the next level. Thank you.